Imagine a world where your health insurance hinges on logging 80 hours of work, education, or volunteering every month. That's the reality now for millions of Californians, thanks to a groundbreaking but contentious Medicaid rule change. This isn't just a policy tweak. It's a seismic shift that could strip coverage from 3.4 million people, according to state estimates. But here's where it gets tricky. The system designed to enforce this rule is still a work in progress, leaving many in limbo. And this is the part most people miss. The stakes aren't just about paperwork. They're about dignity, access, and the future of healthcare for low-income families. The new mandate, pushed through by a Republican-led Congress and signed into law by President Trump, marks the first time in Medicaid's 60-year history that work requirements are being enforced nationwide. California's version, Medi-Cal, serves 15 million people, but now a third of them, those earning between $21,000 and $43,000 annually, must prove compliance every 6 months. Governor Gavin Newsom has called the process a labyrinth of manual verification, with critics warning it could become a bureaucratic nightmare. Martha Santana Chin, head of LA Care Health Plan, predicts 1 million of her 2.3 million patients could lose coverage, a figure that's both staggering and sobering. The debate is as heated as it is polarizing. Republicans argue work requirements instill responsibility and free up resources for those truly in need. House Speaker Mike Johnson of Louisiana put it bluntly, "You return the dignity of work to young men who need to be out working instead of playing video games all day." But Democrats counter that such rules create artificial barriers, especially for those in unstable jobs, paid in cash, or struggling with tech systems. Joan Alker, a Medicaid expert at Georgetown University, explains that people often lose coverage not because they're ineligible, but because they can't navigate the paperwork or fear rejection. It's not just about work. It's about systems failing people, she says. Georgia offers a glimpse into what's possible. Its program, launched in 2023, requires 80 hours of work monthly for those under the federal poverty limit. Over 100,000 applied. But enrollment remains low at 8,000, with critics questioning the $100 million price tag. Meanwhile, California's Inland Empire Health Plan estimates 150,000 members could be at risk, yet no one knows exactly how the process will unfold. Will it be online? Paper-based? Jared McNaughton, the plan's CEO, admits, "We don't really know the process yet." The federal government has allocated $200 million to help states modernize systems, but experts like Ryan Long of the Paragon Health Institute argue this is just the start. Advancements in tech will make this easier, he insists, dismissing concerns as a straw man argument. Yet public opinion is split. A KFF poll shows 62% support work requirements, but that drops to 30% when people learn most Medicaid recipients already work and face paperwork burdens. Newsom's viral image of a 36-page form, teal and gold, like a bureaucratic art project, has become a symbol of the chaos ahead. So, where do we go from here? California's Department of Healthcare Services claims they're reviewing operational impacts, but with federal guidelines still months away, uncertainty reigns. As Georgia's experience shows, the path isn't clear. Is this a necessary reform or a dangerous barrier? Will technology save the day, or will red tape deepen inequities? Share your thoughts. Do you believe work requirements promote responsibility, or will they leave millions without care? The answer might shape the future of healthcare for millions.